For some people, the effects of COVID-19 persist well beyond a few weeks. If this is you or someone you know, you could have long COVID. In this episode, we'll cover the telltale features of long COVID, what to do about it, and when to seek help. Hi, I'm Dr. Sinan, the GP, source on all things health related for you and your family. In the UK, over 4 million people have had COVID-19. Most people have mild to moderate-like symptoms that settle within a few weeks. For some people, though, symptoms stretch beyond weeks into months. If they continue beyond 4 weeks, this is long COVID. The common symptoms of long COVID are fatigue, breathlessness, anxiety and low mood, palpitations, chest pain, joint and muscle aches, and not being able to think straight or focus. If you analyse all the patients who've had long COVID, most people fall into two main groups depending on their symptoms. One group has mainly breathing related issues such as cough, breathlessness or fatigue, and the other group has more generalised symptoms, usually affecting the whole body. It's true that if you were hospitalised with COVID, i.e. the early symptoms of COVID were severe, then you're more likely to have long COVID. But even if your early symptoms were mild, there is still a possibility you can get long COVID, and this is true for both kids and adults. Having said this, there are groups that are more at risk of getting long COVID. These include the elderly, with twice as many people affected over the age of 70 compared to those between the ages of about 18 to 49. White women are also in the higher risk category, especially those in the age range of 40 to 60, and usually those with 2 or more pre-existing medical conditions. Unusually, this is very different to those who are more likely to actually need hospitalisation due to COVID, which is men from an ethnic minority background. And the last group is those with asthma. They have an increased risk of long COVID too. One of the frustrating things with long COVID is that it can seem that symptoms are improving for a time, but then it gets worse again. If you do have long COVID, your journey to recovery will be unique. Just like with any COVID infection, some have had no symptoms and don't even know they have it, where others have really struggled. Everyone that improves gets better at different rates and experiences the disease differently, and this is for an acute COVID infection as well as for long COVID. We don't know exactly what your experience will be, partly because it's unique and partly because long COVID is relatively new. But what we do know from other similar infections is that after about 4 weeks, most chest pain and phlegm symptoms reduce. And after 6 weeks, cough and breathlessness dissipates too. And at 12 weeks, most symptoms have settled, but fatigue can persist. But most people's symptoms do resolve by 12 weeks. For some people, symptoms can continue for up to a year, especially in those who are hospitalised with their COVID infection. Remember though, this is just a rule of thumb, a rough guide of what to expect if your COVID symptoms persist beyond 4 weeks. For any of you that's going through this, I know that this is an incredibly difficult and challenging period. When you're feeling isolated or fatigued, it can be really hard to motivate yourself to try to feel better. Take each day one step at a time. Small things that can help your recovery include trying to be good to yourself. Stick up post-it notes with small words of positivity which you'll see on a daily basis. Perhaps your bathroom mirror. That small boost can really help. Keep a simple routine. Don't overkill it and try not to push yourself too hard. Remember, small steps at a time. If you haven't already, prioritize your sleep. What you do before bed and shortly after you wake up should be a priority. Try to connect with your family, friends, or neighbours. Try calling or hearing loved ones' voices through voice messages rather than texting. Keeping active is a challenging one, but it is so important. Even if it's just small steps inside your home, or stretching your arms and legs, or moving your feet up and down whilst you're seated, small movements will help lubricate your joints and strengthen your muscles over time. On that note, if you feel up to it, strength exercises can be really helpful for muscle and joint pains and can help with your body's general resilience too. I'm thinking of things like yoga, Tai Chi, or using light weights. And finally, breathing control techniques have helped some of my patients, especially with breathlessness and cough symptoms. By the way, if things are unmanageable, you need help, or you're worried and your symptoms have gone on for more than 4 weeks, then do speak to your GP. They can make sure nothing else is going on, and with a detailed history, examination, blood tests, and maybe a chest x-ray, they can help make a plan for next steps. For most people, long COVID is manageable at home. For some people, depending on their symptoms, they may benefit from things like physiotherapy or mental health support. We know that long COVID can be debilitating for some people and can have a massive impact on your life. If this is the case for you, you may be referred to a long COVID clinic for further assessment and more comprehensive support, or even a specialised rehabilitation service. I've included some links in the description below with some useful resources and support on everything from the breathing techniques I mentioned earlier to tips to manage specific symptoms. Today's take-home messages are: if you've had COVID and your symptoms are going on after 4 weeks, you've got long COVID. Fatigue, breathlessness, anxiety and muscle aches are common symptoms. Anyone can get it, but it's commoner in the elderly, white women and asthmatics. Things tend to improve for most people by 12 weeks, but sometimes symptoms can linger. If you have it, keep a routine, stay positive and active, and connect socially. And remember, if you're struggling or worried about new or worsening symptoms, please do speak to your GP. We are here to help as best as we can. If you found today's topic useful, don't forget to share with your friends and family and click the subscribe button to stay in the loop. You can find out more at drsinanthegp.com. If you have any questions or comments or suggestions for future topics, I'd love to hear from you, so do message in the comments below. Thank you so much for watching. Till next time, stay healthy.